Welcome to Health Talks. I'm Gail Hogan, and today we're talking about the unique field of neuroplastic surgery. Dr. Carrie Ann Mitchell joins us to share what it is and who it's for, and the expertise found here at Ohio State. Hi, Doctor. Welcome.
Hi, how are you?
I'm good, thank you. We're going to talk about neuroplastic surgery.
Yes.
What is it?
So neuroplastic surgery, it's a relatively new field or new subspecialty, primarily of plastic surgery and neurosurgery, as the name implies. And what it is, it's a specialty focused on multidisciplinary care for patients who have complex needs that involve both specialties, primarily neurosurgery, plastic surgery.
So give me an example of who would your patient be? What, brain surgery, spine surgery? I'm not sure.
All of it.
Okay.
But primarily with the skull. So patients who have something going on with their skull, and we say we're missing a piece of their skull from a surgery that they've had previously, and may also have something to do with their scalp. So a lot of our patients are stroke patients, so patients who come in with a stroke and they need to have a surgery to take out a piece of the bone so their brain can have space to, the brain swells and there's nowhere for it to go. And if that doesn't happen, if you don't take off a piece of the skull, that patient can actually die. And so it's a life-saving surgery to remove a portion of the skull. So when those patients survive, you have to fix their skull. And so that's the population of patients that are mostly seen in a neuroplastic surgery setting, where they need their skull repaired. Some of them also need their scalp repaired. If they had trauma, such as from a motor vehicle accident or something like that, and they had brain injury, then those patients are also part of our population.
So what have most of these patients been through? You mentioned a few.
Mm-hmm.
They're going through or they've been through something catastrophic.
Right. So a lot of our patients have been through very significant events, whether or not that is a stroke, so they come in through the emergency room and they need to have an acute surgery, so something done emergently to save their lives. Same with the motor vehicle accident, they had a traumatic brain injury. We don't talk about as much, but also our patients who are in the battlefield, so our military veteran patients who may be in trauma, they also have traumatic brain injuries and have a portion of their skull removed. And so many of those patients come back and they have a piece of their skull missing. And so we reconstruct those patients to help them get back to their normal quality of life.
That was my next question is this considered reconstructive surgery, not really plastic surgery? Right.
So plastic surgery is interesting because plastic surgery is both reconstructive and aesthetic. And I always think we don't separate the two. It is reconstructive in the sense that these patients need it. It's a medical and necessary procedure. But you can't really distance it from the aesthetic because everybody wants to have that. Simply just patching something isn't acceptable for patients, and so we still have to think of the aesthetics as much as it's considered a reconstructive procedure.
And the neurosurgery part of it?
So maybe not aesthetic from the neurosurgeon. So maybe not from the neurosurgeon perspective. The neurosurgeons are saving lives. So I always say from the neurosurgeon perspective, it's a life-saving procedure. From the plastic surgeon perspective, it's a restoring life procedure. Because I think you're alive, but if you are not happy with yourself, are you really living, right? And so that's where I feel like plastic surgery comes in.
Can you name who would be on the multidisciplinary team? Who does that encompass?
Yeah, so it's a pretty big team, and it's more specialized for patients' needs. And so the way I look at it, at the core, you have a plastic surgeon and a neurosurgeon. Here at Ohio State, we're fortunate to have a very robust neurosurgical group. And so for patients, if they had a stroke, that's a vascular neurosurgery issue, we have vascular neurosurgeons. And so somebody who specializes in that. If it's a tumor, we have neurosurgeons who specializes in brain cancer. And so a lot of the patients who come here, if they're referred, they'll primarily be referred for plastics because they've had wound healing complications or they've had some other issues, and they're referred from other centers to us. And so then we could just plug them into the group that they need to create a specialized team for that person. And so the teams look slightly different depending on who or what the patient's needs are.
But there's a lot of people who work together.
There's a lot of people. Neurosurgery, plastic surgery, APPs. We have a PA who's dedicated to those patients. We have nurses, occupational therapists. We have the DOD rehab center, which plays a major role for many of our patients. When their surgery's done, they still need to do rehab. So we have it's a large team.
You mentioned medical need, neuroplastic surgery. What about pain relief?
Right. So interestingly, many of our patients don't have significant pain. For whatever reason, I guess the brain doesn't really have pain sensors, right?
Wow.
So a lot of our patients, some may have headaches, but typically they're presenting with neurological deficits. So they may not be able to speak well, or they may not be able to walk well, or they may not be able to eat well. So more functional deficits, and it's called syndrome of the traphind, which is this it's this constellation of symptoms that come up because a part of your skull is missing. And so there's a lot of research ongoing, but we still can't tell you what symptoms will get better when you fix the skull, but some of these symptoms do get better. And so a lot of our patients, they're, oh, now I can walk better, or I went to rehab and I did so well. And that's something that's so special to see.
Why is neuroplastic surgery unique? Why would you say it is?
Yeah, I think neuroplastic surgery is unique because it's just a multidisciplinary approach. And I think it's a way to see patients as individuals, not like a group of patients. You all come in, you all need the same thing, you all get the same thing, but to be able to help patients where they are and helping them in a very customized, specific way. And I think we do that really well for many, many aspects of medicine. For example, breast cancer treatment. If you think of the Spielman Center, breast cancer, they get like super well customized care that's aimed at those patients. And that's neuroplastic surgery. I always think of that like someday neuroplastic surgery, how we treat our neuroplastic surgery patients is going to be like how breast cancer is managed. It's comprehensive, multidisciplinary. The patient doesn't have to go all over the place to get care, but they know this is the center I can come and I can have somebody else who be behind the scenes making sure everything happens for me.
You want to help these patients move on.
Move on, yes. Get your surgery, go on with your life, live your life. The happiest day, I'm like, you never have to see me again. And then the patients are like, okay.
You use sophisticated technologies and tools in your surgery. Can you explain a little bit of that?
Yeah, I would say for us, a few things are very specialized. Primarily 3D printing. So 3D printing technology lets us create custom implants for patients. So if somebody is missing a portion of their skull, we get their CT scan, and then an implant is designed specifically for that patient. And so it helps to it matches the other side of their head. So you could look at a patient, like, I mean, I could have an implant in my head right now and you wouldn't know it, right? So that's how 3D printing lets you be able to build an implant that's specific for a patient.
That is part of the expertise that's here at Ohio State. What else would you say is special about here at Ohio State for these patients?
I think the ease with which we can get patients what they need. So we've developed a team that patients can move through pretty seamlessly. It's not a referral here, a referral there, a consult here, a consult there. It's one system, and we have all the needs of our patients in one area. So I think for me, I think that is the most incredible thing. Like a patient comes in and we can get them into the OR as soon as they need to be in a reasonable time frame, and get them their imaging done in a reasonable time frame, get them to see all the specialists they need in a reasonable time frame. That for me is just the best part.
Why did you decide to specialize in this? I'm talking about neuroplastic surgery. What's your background?
Yeah, so my background, interestingly, I did a PhD in neuroscience before I went to medical school. And so I've always been fascinated with research and making things better. And then I realized I was missing the patient care aspect of it. And so I went to medical school after doing my research. But then after I completed medical school, completed my residency in plastic and reconstructive surgery, I sort of had a full circle moment where I realized that patients who are, we have excellent care for pediatric patients in a children's hospital. So kids who have TBI, they're going to get the best care in our pediatric hospitals. For patients who have, once you become an adult, then you're all over the place, just so very decentralized. And so I wanted to be able to help move beyond just offering the surgery, but also helping with the care coordination and the quality of life aspect for patients. Because it doesn't matter if you can do a great surgery if patients are still just having a poor quality of life. And so that was what brought me to neuroplastic surgery.
I like it when you said to the patient, you don't have to see me anymore. That's your ultimate goal, right?
Yes. Go back to your normal life and don't think about doctors. Don't call yourself a patient. You are who you are before all of this started.
Thank you. It's nice to talk with you, Dr. Mitchell.
Thank you.
And thank you for joining us for Health Talks.